Hello and Assalamu Alaikum. What follows is a brief report regarding Falah Hospital, which started offering its services in January 2011. Falah Hospital is situated in the heart of Kunduz province and is equipped with modern medical equipment and staffed with very experienced physicians specializing in internal medicine, gynecology, pediatrics, laboratory processing, ultrasound, ECG, surgery, and X-ray services. On average, over 50 patients visit the hospital each day and require various services ranging from general checkup, maternity and obstetrics, pediatrics, lab, ultrasound, and radiology. The hospital currently has 10 inpatient beds and offers 24-hour services. Dr. Abdul Latif Sharifi, a specialist in heart and lung medicine and the head doctor of the hospital, says the hospital began its 24-hour services 7 days a week in January 2011. Our services currently include internal medicine, maternity, pediatrics, and diagnostic services such as lab, ECG, and radiology, as well as being equipped with 10-bed inpatient services. The interviewer asks, what are the main issues facing the people of this region? To which Dr. Sharifi responds, the communities of this region face an enormous number of difficulties throughout all walks of their lives, but specifically in health-related issues. The interviewer then asks, can the people in this region afford the expenses of health-related bills? To which Dr. Sharifi answers, you must understand that the people in this region have suffered for the past 3 decades in many different respects, but especially economic. These hardships are very tangible and impact all of their lives. Paying bills for medical treatment is just one more added difficulty. The interviewer goes on to ask, what is the scope of services offered by Falah Hospital? Dr. Sharifi states that Falah services are aimed at the underserved population in the region. On one hand, the local general hospital is overloaded with patients, and there is a great need for more health services. Therefore, Falah plays an important role in filling that shortage. On the other hand, private clinics are traditionally very costly, and the local people cannot afford their services. By offering services to those who are unable to afford these high local fees, Falah plays a very important role. Falah has a very significant role in taking care of these patients throughout this region. The interviewer then says, what is the most significant impact that Falah services has on people's lives in this region? Dr. Sharifi responds that Falah has adopted a very moderate fee policy in terms of affordability. Our policy is based on a sliding fee scale. It isn't free, but neither is it priced too high, making it unaffordable to those with difficulty in paying their fee. The interviewer asks whether Dr. Sharifi can elaborate more in terms of the fees in comparison with other private clinics in the region, and Dr. Sharifi explains that Falah must still prove its sustainability over the long term. Therefore, it does need to charge a small fee to cover its costs. We charge people a 50% discount from what other local clinics charge, he says, but as I mentioned regarding the sliding fees, in some instances, we charge patients only 30 to 40% of what others charge based on that patient's economic state. The interviewer asks, what are the main challenges experienced by Falah Hospital? To which Dr. Sharifi says that the main challenge is the inadequacy of space and having a non-standard building as a base of operations. He says that they have a great influx of patients on a daily basis and are unable to accommodate them sufficiently. For this reason, Dr. Sharifi states, we need a larger facility, one better equipped with advanced medical equipment and which can accommodate at least 50 beds. The interviewer asks, what recommendations does he have for improving their services? To which Dr. Sharifi responds, I would like to see improvements in terms of attaining a standard hospital building with the facilities necessary to accommodating all of our needs, our wards, our labs, etc. He'd like a larger space, better capable of responding to the community's needs, with at least 50 inpatient beds. And lastly, Dr. Sharifi says that putting into operation advanced medical diagnostic equipment for the lab, radiology, and ultrasound, so that they would better be able to position themselves in providing in-depth medical analysis, diagnosis, and the results. When asked whether he would like to share anything with the viewers, Dr. Sharifi responds, "I have a lot of passion in serving this community to the best of my ability, and I ask that people come experience our services for themselves and see what we've prepared. You'll see the quality of our services and our dedication in all of our daily duties. We aim to make you feel comfortable and confident in our services. There are specific areas and wards that have been designated for patients related to their specific medical issues, so that the patient and whoever accompanies them can go directly to the relevant department." The administrator of Falah, Dr. Isa Tawhidi, says, "We've hired a very motivated receptionist to direct patients to the correct ward after registering the patient and identifying his or her related issue. The patient is issued a permit after paying any necessary fees. This system of managing a huge influx of patients has been practiced since the opening of the hospital, and it works very efficiently and helps prevent any unnecessary wait time for the patients. Although the hospital possesses excellent medical equipment, I would still like to see even more advanced medical equipment and labs so that we can better serve the community. I'm extremely satisfied with the team we've assembled here and for the services we offer, but I would like to see us improving day to day in terms of delivering more quality services for our people." My name is Abdul Latif and I graduated from Ganzafar Institute of Kabul. I'm currently serving the Kunduz people through Falah Hospital. I conduct very important laboratory tests and analysis on urine, biochemical samples, and blood samples. But I'd like to say that the space we use for our lab is just not big enough. We need a larger space with more sophisticated lab equipment. For more thorough, accurate, and deep analyses, we need to expand this facility as soon as we can. Falah medical staff is hoping to have permanent services for children, and for the time being it only has outpatient child services. Dr. Zemare Warid says, "I assist newborn postnatal babies when they have medical problems, as well as those children coming in as outpatients. The main focus at Falah Hospital is on maternity-related issues, and I take care of pediatric patients. The noble people of Kunduz are very happy to have outpatient services for their children. I take care of 10, 20 children per day. Any who need to be hospitalized are referred to the General Hospital of Kunduz. I very much would like to see an expansion of our current health project and hope it happens in the near future. We need so many wards for our children. Malnutrition is a major concern for these kids, and it needs to be addressed and integrated into Falah's standard services." This baby is only 2 days old, and he was born with a blockage in his bowels. I called the surgeon to remove the blockage. Dr. Zimmerey word says. This problem was immediately taken care of, but he still has some other birth defects. Like here in his left foot, and he definitely needs to go to an orthopedic specialist. Dr. Razia Akbari, gynecologist and ultrasound specialist. She is very pleased to have access to advanced ultrasound machines, but she has still some concerns with Falah's space limitations. Dr. Razia says, I receive 10 to 15 patients each day. I need more training on this ultrasound machine because this machine has many other important features that I would like to become familiar with. I would like to be able to use the equipment to its fullest capacity. The current building is not sufficiently large enough to accommodate all of our immediate needs, so I hope to have a larger space, one that could match community demand as well as our own inpatient needs. Dr. Fahima Kaun Sharifi says, I am in charge of maternity and obstetrics and receive about 2 or 3 maternal issues on a daily basis. We've seen about 1,420 patients in the last 2 months, including 70 patients who gave birth, 5 of these needed a C-section, and 10 curettage patients, 20 patients with maternity-related issues. The fees are very affordable for the underserved population of the region, but the hospital's current capacity is very limited due to space. We offer 24/7 service, and midwives are always on duty, as well as other outpatient services that we provide. Falah was created to offer reliable, affordable, and safe services to the people of Kunduz. Therefore, people express their gratitude and thanks, and the people, they feel very confident in using our services. We all hope for a further expansion of this current project. Here the interviewer asked several of the patients their opinions and experiences at Falah Hospital. This man says that he has come with his family to this hospital and the fees are very affordable, and that the staff treats everyone very friendly and nicely. This patient says, my name is Sayed Aga and I live in Khan Abad. I am a shopkeeper and have been here twice so far. The hospital is very clean, well equipped, and the waiting time is minimal. Everyone is so nice. The results of their treatment so far has been very positive and satisfactory, and this is why I came back for a second time to obtain their services. We are all very pleased with the services they offer, and they do so with such kindness. I would like to ask everybody to support this hospital in whatever way that they can, and I hope that there is an expansion of this kind of thing to help accommodate others in their need. Mamur Ikhlas from Imam Sahib has to say, I brought 2 patients to this hospital. One was diagnosed and prescribed medication, and the results were very satisfactory. The doctors here treat us very kindly, and the fees are very affordable. When asked, are you happy with all of these services? He responds, certainly. I am very pleased, and the proof of my happiness comes from the fact that I have come from a very long distance to obtain these great services.